Have you ever had a hospital bill that took forever to pay off? Medical bills, well, they can pile up pretty fast, especially when you're very sick. And doctors are doing everything they can to help get you well. In the case of the coronavirus, if you come down with COVID-19, well, you might just get a case of sticker shock when you see the bill. It happened to Michael Floor in Washington State. He survived the coronavirus, but his bill, totaling more than $1 million, sent him into a state of shock. But not all bills get so high. Dr. Tim Martindale of Waco caught a bit of a break when he caught coronavirus.
My illness was moderately severe, and I was sick for about a month and missed a month of work, but I never ended up having to go into the hospital or have a ventilator, so my costs were low.
The more care you need, the more expensive it gets, and hospital costs are notoriously high. Dr. Martindale says with good reason. Yes, a hospital may charge you $5 for aspirin. Why? Because that also helps pay for the nurse that administers it and monitors your response. COVID, unfortunately, needs lots of monitoring, particularly when special equipment gets used.
Those who do end up on a ventilator end up spending 1 or 2 weeks on the ventilator, a long time. So those bills can be quite astronomical.
But Dr. Martindale says we're not helpless when it comes to hospital bills. He says, first, make sure you get an itemized bill. If you don't have insurance, let the hospital know that. Then, do some comparison shopping. He says because insurance companies negotiate their prices, we can too.
And then find ways to pay in a similar way to what Medicare or another insurance might pay, and make that an offer that the hospital would always accept from an insurance company. Therefore, they should be willing to accept that from you.
In the case of COVID, the federal government pays some of the bill through the CARES Act. Martindale says go over the rest of your bill with your doctor, who can help separate overcharges from normal and customary ones. If you have insurance, the hospital and doctors can go back and forth on payments for months. But whatever insurance doesn't pay, we do. Unfortunately, there aren't many charities that help people pay the huge leftover bills, so for now, we're on our own. So maybe the best and the cheapest route is to wear our face masks, keep our social distance, and follow those cleanliness guidelines. It's a whole lot cheaper than $1 million bill. In Waco, Dennis Turner, 25 News.